Nurse Theorist Dorothea Orem by Christina Hay. Dr. Dorothea Orem was born in Baltimore, Maryland in 1914. She received her diploma from Providence Hospital School of Nursing in 1934, a Bachelor's of Science in Education from the Catholic Universities of America in 1939, and in 1945 an MSN in Education from the same Catholic University of America. She received honorary degrees from Georgetown University, Incarnate Word College, Illinois, Wesleyan University, and the University of Missouri at Columbia. Dr. Orem was also inducted into the American Academy of Nursing and won numerous awards, including the National League for Nursing, and was inducted into the Sigma Theta Tau Nursing Honor Society. Dr. Orem's early years were spent at Providence Hospital, where she served as a staff nurse, and then she moved on to St. John's Hospital. In 1945, when she received her MSN, she became director of the Providence Hospital School of Nursing, the same school she attended. While director there, she also taught biological sciences and nursing classes. She then moved on to the Catholic University of America, where she served as assistant professor, associate professor, and also dean of nursing. Dr. Orem worked as a curriculum consultant also. As a curriculum consultant, Orem worked with schools and departments to enhance their curriculums. She worked with schools such as Georgetown and the University of Southern Mississippi. She also worked with Johns Hopkins Hospital. In 1971, she published Nursing Concepts of Practice, which included her theory, the self-care deficit. Nursing Concepts of Practice is now in its 6th edition, and her theory has been published many times. Dr. Dorothea Orem died in 2007. Dr. Orem lived through 8 decades. You can imagine she saw many different social changes. These are a few of them. She saw anywhere from the Great Depression, World War II, DNA was discovered. She saw Medicaid and Medicare founded. She saw the Civil Rights Movement, Microsoft being trademarked, the Space Shuttle Challenger explode. She saw the Gulf War and even domestic terrorism attacks. Now on to Dr. Orem's nursing theory, the self-care nursing theory. The entire theme is self-care for the patient. The nursing care for the patient should be separated into 3 parts, either total care, such as wholly care for the patient, partial care for the patient, or just supportive care, such as teaching. We must first assess the patient to find out their self-care deficits. Then we must identify interventions and determine which interventions the nurse can perform as opposed to what the patient can do for themselves. The nurse must then decide which interventions require which helping methods. The helping methods are acting for or doing for another, guiding and directing, providing physical or psychological support, providing a therapeutic environment, or teaching. And all interventions fall under one of those 5 helping methods. Dr. Orem defines the nursing meta-paradigms as the following. Nursing is the actions to overcome or prevent self-care limitations or provide self-care. Person, which is composed of the physical, psychological, interpersonal, and social aspects. The health, which is the internal and external conditions that permit self-care needs to be met, and the environment, which is anything external or outside of the person. Finally, how can this theory be used in our current practice? In the hospital setting, we can use this theory by prioritizing our patients' needs, which helps provide the most adequate care possible. It also helps the patients do more for themselves, which could lead to faster recovery time. The theory could also provide opportunities for patient teaching, which is always needed. In the clinic settings, the teaching opportunities are vastly important. They help the patients reach their maximum health. I believe healthcare is moving towards more of a patient-centered approach. Patients need to take more control of their self-care with guidance from the nurse and/or healthcare team. These things make this theory very relevant in today's practices.